back to Unmasking the Trans Movement with John Mueller. I'm your host, Brad Wilder. Today on the show, John and Jenny Kyng are going to sit down and discuss gender affirmation therapy. They've got lots to talk about, and we're going to get into that in just a minute. You're watching Unmasking the Trans Movement. We'll be back with more right after these.
Do you notice a change in your child? Do you wonder what's going on with my child? Do you finally see something others have been seeing for some time now? Do you see the ideology and indoctrination after your child returns home from school every day? Do you see? Yes, you do see the harm and the confusion they are causing. Do you see the role they are playing on your child's life and development? Do you see? Yes, you see now. And now you have questions. At Unmasking the Trans Movement, we're here to help answer those tough questions you can't ask anyone else, or answers that are hard to find. We discuss the many topics of this evil agenda indoctrinating our children into a world of self-destructive deviance, constant medical care, and human degradation. Our webinars provide access to supporting groups discussing the tough issues you want to talk about with real parents and experts alike. Sign up and become a member now and you'll save 30% off your first-time membership starting at just $7. Select from our bronze, silver, and gold packages, all with different options depending on your needs. Our mission is clear: to unmask the deception and protect the most vulnerable among us, women and children. For webinar dates, times, and pricing, please visit our website at unmaskingthetransmovement.com/webinars.
Welcome back to Unmasking the Trans Movement with John Mueller. I'm your host, Brad Wilder. Jenny Kyng is all standing by and ready to go along with John Mueller. Let's bring John in right now. John, a great show ahead today. Why don't we tell everybody who our wonderful guest is and where she's from?
Brad, thank you. We have Jenny Kyng back with us. I so appreciate Jenny. She is from Tasmania, way down under, and we appreciate her being willing to come back as a return guest. I strongly recommend that people go back to her previous visit. That would be
episode 5, John.
Say it again?
Episode 5.
There you go, episode 5. That's exactly. No, and Jenny was describing in that 2-part episode gender affirming care, the problems and the concerns with gender affirming care. We are now going to look at the affirmation model. And Jenny, welcome back. If you would, why don't you share a little bit of your background, tell people how they can get a hold of you, and then let's do a little recap of your concerns, because you listed those out very methodically, very fact-based, because we're not anti-anything here other than that which would put vulnerable people, especially women and children, at risk. And that is what we stand up against, and that is what we are here to discuss, which is, in today's topic, the affirmation model. So welcome, Jenny. Thank you for coming back with us.
Thank you, John and Brad. Great to be here. So a little on my background. So I've been a registered nurse for over 30 years and have worked mostly in mental health, including especially drug and alcohol and eating disorders. I chose to stop practicing as a registered nurse to change my career to being a counsellor. So I've been a counsellor and psychotherapist for 10 years, and I'm still registered as a nurse, however, just a non-practicing nurse. And my concerns about gender affirming care are, in a nutshell, that it's completely unscientific. It's a total abrogation of everything that medicine and therapy should stand for. There is no evidence to support it, and it's doing immeasurable harm to vulnerable young people. So, yeah, does that sort of address the questions you asked? Have I missed something? Let me know.
No, you did. And I really want to encourage people to go back to that, the first episode that we were together, episode 5 on our channel there on our YouTube. I'm sorry, on the site, unmaskingthetransmovement.com. And
Sure.
please go back, because Jenny reviews, you did an incredible bullet point list of the abject harm that this is doing. The trans movement is really the greatest deception that's ever been foisted upon vulnerable children and their families. As we mentioned last time, this whole thing did not exist prior to 2005, and so the trans movement is a moving sidewalk that kids get on. At some point in time, they'll do the social transitioning, but eventually they start to become medicalized. They start to be they're put on puberty blockers, then cross-sex hormones. That'll sterilize them, and then they're going to be dumped out onto the surgeon's gurney. And you listed the effects of all those. We ran out of time, Jenny, so you're back now to talk about what is called the affirmation model, but I really liked how you put it prior to the program. You talked in terms of it's not just pertaining to that term, not just pertaining to psychotherapy, but also medicine and the full umbrella. So speak to that, help educate parents and other good people about what this term is, because it's being thrown around as far as affirming or affirmation.
Sure, John. Yep. There were just a few side effects I forgot to mention or didn't have time to mention, and one of them would be dementia. So people are at increased risk of dementia. I don't think I mentioned that. Children are also at increased risk of a brain tumor. Now, it's a benign brain tumor, but any brain tumor is a massive problem through
Now,
puberty.
this is with the puberty blockers or cross-sex hormones?
Puberty blockers. Puberty blockers increase your risk of a benign brain tumor. I believe it's called tumor cerebri. So it's a space-occupying lesion in your brain, and we don't want anything in our brain that's taking up space that shouldn't be there. It's a major problem. Blindness is also another problem. And also, we have the problem that people lose sensation in their genitals or their newly created pretend genitals, so they can no longer enjoy sex or experience orgasm. And we also have another problem of people experiencing painful orgasm. So some girls who go on testosterone get excruciating, agonizing uterine cramps in their uterus when they have sex, agonizingly painful. So they have painful orgasms. Now, that's just a contradiction in terms. That should not be something that anyone should be encouraging young people to do. Then we have another problem. People who've had mastectomies, they can have phantom nipple sensations after their nipples have been removed. So I've seen this on one of the documentaries about the many side effects of transition with this girl who they showed just after her mastectomy, she was crying with happiness. Then something like 6 months later, she appears to be in a psychotic state and she's crying out, "Whoever is tweaking my nipples, pinching them, stop doing it. Who are you?" You know, quite mad, obviously, as a result of everything she's been through, but she's having this unbearable sensation in her nipples that have been removed. And that is going to be a lifelong problem. Then we've also got Richie Herron, a British detransitioner, who had all of his genitals removed, his penis, his testicles, and he now is left with a little stump because they couldn't remove all of the penis. He's got this little stump that still has erectile tissue in it. So every morning that little stump gets hard, and that is painful. And so he's got this sexual feeling and absolutely nothing he can do with it. So those are just some of the more horrific side effects and complications of this insane experiment on children and young people.
And you called it correctly, Jenny. This is so sick. There's no other way to put it. This is sick to do to kids. There's no justification. It never existed beforehand. And greedy, diabolical medical professionals are doing this for profit. As a matter of fact, if any of them want to debate this issue, they can come on this program with us.
Exactly. That would
you and I will be happy to have a discussion with any medical professional who wants to come on and try to justify the slicing and dicing of sex organs off kids and try to tell us that somehow these kids, these very vulnerable kids, many of whom have been sexually molested and or are on the autism spectrum, that somehow they will benefit from this Frankenstein-like, how do we describe, Nazi-esque like treatment.
Exactly. Some of these doctors are maybe not doing it for profit, but I believe they have a kind of Munchausen syndrome by proxy. So they're using children, creating illness and disease in them that doesn't exist, pretending they have this disease called, trans-identification, which they don't have. It's inculcated in them. And then they're doing it for their own narcissistic supply. Look at me, I'm a savior. Aren't I wonderful? I'm helping all these children. It's narcissism. And whichever way you look at it, though, there is no excuse. They should know better.
That's right. And the reason I say for profit is I notice none of these doctors are donating their time. But point
no,
well.
Exactly.
Okay. So Jenny, we ran out of time. You covered, as you did last time, you covered the physical effects. You went through very methodically. So again, people should go back and watch that. We ran out of time to discuss what's being called affirmation therapy or the affirmation model.
Right.
So talk to us about that. Let's cover kind of a large umbrella look at this, and then we'll get down to some of the different disciplines.
Sure. So what affirmation means is basically that if a client comes to a therapist or a doctor and says, I believe I'm a boy, and say they're a girl, you have to agree with them. And it's the same with a girl that comes in saying they're a boy. Either way, I don't know if I've got that mixed up there, but either way, whatever they say their feeling is about their gender, which is really a concept that has no scientific basis, we must agree with them automatically. There's virtually no assessment. There's no scrutiny for other factors that could be causing this dysphoria. And there are multiple reasons for kids and young people having dysphoria. But we ignore all of those. We're just supposed to go straight for believing exactly what they say. That's what the affirmation model is. We affirm them in their belief about themselves. And this is something...
It's fast-tracking kids. That's
exactly.
All this is.
It's fast-tracking kids. It's about becoming a rubber stamp for them to go on and be medicalized. And the kids also, they study the criteria for gender dysphoria. So they know exactly what to say. They have a script. They all say the same thing. And so they know what to say to get what they want, naturally, because they've been told that they need this. They're getting that message online. They're getting it from teachers. They're getting it from their fellow students at school. So they know what to say, and all you are is a sort of stage one of getting what they want, which is puberty blockers, hormones, and surgery. And the state is collaborating with this in the sense that as a therapist or a doctor, you're not allowed to question the idea that they are the opposite sex or that they're non-binary or one of 100 different genders, because now there's an infinite variety of genders you can be. You can even be a eunuch. You can have a eunuch gender identity, and we're supposed to take that seriously. And this is coming from WPATH, the World Professional Association for Transgender Health. They're saying that children as young as 3 can have a eunuch gender identity, and we should assist them to have their genitals cut off and all external signs of sexual development removed from their bodies.
Jenny, I want to encourage people right at this point, because you referenced about, and people need to really understand this term because it's kind of come out of the blue, that there's going to be a eunuch, not unique, but eunuch as far as sterilized, right? Identity. Now, Genevieve Gluck has done a wonderful series of investigative reports. You can go online and look her up. She has done a deep dive into WPATH's, the World Professional Association of Transgender Health. Dr. Bowers, I believe, is the current president. That's the one that sliced off Jazz's penis and testicles. So people are probably familiar with Dr. Bowers. And this issue of eunuch, Genevieve Gluck was able to uncover and trace back that there is a very deviant group of sexually perverted, likely predatorial, I'll make the case predatorial, men who've created what's called the eunuch archives. And these porn-fueled men have written what amounts to child pornography, but it goes beyond that. It has to do with their own fantasies where they can castrate, mutilate, and even cause these young kids who they're going to these men that they're going to sexually abuse. They make these young kids eat their testicles and eventually execute some of these kids. Those are called the eunuch archives. Genevieve Gluck was able to hack into or pose as one of these deviant freaks, the predators, and she was able to get screenshots and show how dark and deviant these men are. And then lo and behold, some of these men have served in a capacity to advise WPATH. And so now, lo and behold, we have what's called a eunuch persona, or a eunuch personality, right? Or identity.
Gender identity.
Right? And so this screams of child predation.
Absolutely. It certainly does. And these men suffer from something that used to be called skoptic syndrome, which is that they're sexually aroused by the thought of mutilating and hurting and even killing children. And apparently they lobbied the writers of the Diagnostic and Statistical Manual, the Psychiatrist's Bible, to remove skoptic syndrome from the DSM. So that's no longer there. It's been disappeared. It's been sent down the memory hole, to quote George Orwell in 1984. So that's a perversion that is no longer researchable because it's been removed from the DSM. And it's obvious that these men are trying to facilitate these appalling surgeries for their own nefarious sexual gratification. And I wouldn't be the least surprised if footage of these surgeries is being provided around the world on the dark web to men like this. And, if you watch Marcy Bowers in some of the Jazz Jennings videos, at one point she's telling him that there wasn't enough penile tissue left to create a viable vagina because of all the puberty blockers. His penis was tiny, so you couldn't really make a proper vagina out of it. And she's saying, let's just have a look. And then she says, oh, your genitals have been photographed more than a porn star. And she laughs. Marcy Bowers is a man. I should call him he. See how we all get brainwashed by this stuff.
That's right.
He laughs. And it's just, he is revealing a lot in that statement. It's not a joke. So, where's the footage of all these operations going? I'm sure it's being circulated.
I've seen that clip. I put it in some of the YouTube videos that I've put together on the dark agenda behind the transgender movement. It is really surreal in that moment to have that doctor, this young boy. I mean, look at the state that Jazz is in now. He's in horrific shape. And this mother has been revealed on camera. She's so brazen and blatant about it that she is the mother, who at the very least has Munchausen syndrome by proxy at most, and I think we're dealing with a severely personality disordered individual, if not worse, quite frankly, that she says this mother is concerned that she has to wake Jazz up out of a sleep to continue the dilation process of this fake vagina, which is actually a wound that is trying to close because they drilled a hole in a little boy, or
exactly.
By that time an older boy.
Exactly. She's actually apparently threatened that she'll go and dilate him if he won't do it himself, and that's just blatant sexual abuse.
Correct.
Yeah. And This is the trouble with the affirmative model, is that we're enabling all these abuses. We're just giving up on the scientific method entirely. All doctors and therapists are supposed to give that up, because otherwise you can be charged with practicing conversion therapy, which is a complete inversion of reality, but we'll get onto that in a minute. But if you don't go along with the affirmative model, you can be charged, you can be jailed as a therapist or a doctor. So we're enabling all these appalling abuses in order to basically sort of emasculate science and medicine so that it can't question this insane ideology. And it's just managed to establish ideological tyranny over all sectors of society. And we should not be going along with it. People need to stand up and say, no, this is insane.
And just again, for somebody that's watching, a parent or anybody that is halfway protective of kids, to really let this sink in, that the entire field of mental health and medicine now if you have a young person who's gender confused, who's been manipulated, who has been, we used to call it brainwashing, but comes in and sits in front of you and says, I don't want to be a girl. I don't feel like a girl. I feel like a boy now. The therapist or the doctor. So Jenny, what you're telling us is this affirmation model or approach is that if I have a young person that sits in front of me who's just announced, again, that means I'm dumbed down as a mandated reporter, because any mandated reporter, if they have a girl in front of them that says, I don't want to be a girl, I wish I was a boy, the most normal and natural question, according to our training as mandated reporters of suspected child abuse, one of which is sexual abuse, if you have a young person that doesn't want to be their gender, we should begin to ask the follow-up questions to find out, is that child being raped? Is that child being perped on? But now we can't. We just say, oh, okay, well, here's your script. Off you go.
Exactly. We've had to disregard all the normal assessment approaches and child safeguarding principles that have been put in place over the centuries and decades. They're all out the window. And instead of the usual scientific method-based assessment approach, it's just gender. Gender overshadows everything. It's called diagnostic overshadowing. Instead of noticing all the red flags, that there's a hell of a lot more to this, we're supposed to just grab onto the gender dysphoria and fast track them to medicalization.
This is the ultimate don't ask, don't tell. This is the perfect predator protection plan.
Yes, it is. Absolutely. That's a good way of putting it. It totally is. Yep. And they've made sure that, like there's a lot of money behind this and there's a lot of egos behind it. Like I said, it's not just money that corrupts people. It's the thought of professional status, success, fame, glory, being idolized that will corrupt people. And we've seen this before in medicine. We've seen horrific abuses committed by people who think they're going to get a Nobel Prize. Like, for instance, the lobotomy scandal, where doctors were sticking ice picks into people's brains and scrambling the connection between their left and right hemisphere of their brain. The fellow that pioneered that, who developed it, Ego Moniz, I believe his name was, he's the one who came up with the idea in the first place, he did win a Nobel Prize. So, there's all that narcissistic reward that is very seductive to people in medicine, psychotherapy, all areas, teachers too. It's not just money that corrupts people. It's the dream of being famous.
And now that the pushers of this have captured the language and therefore captured the legislation, we are not advocating for conversion therapy. As a matter of fact, the idea of that is a misnomer on so many levels, but therapy is not about converting anyone, quite frankly. Jenny, you're a psychotherapist. This will be good. Really, a good education. So tell someone who might say, so you're getting close to the line of, conversion therapy, you're talking about it. Talk to the average person, the average parent. What's the goal of therapy? You're a psychotherapist, so am I.
Sure. The goal of therapy is to explore and to help someone and to help us in relationship with them to get a real understanding of what's happening for them, who they are, what's happening for them, what they want in life, what all the factors are in their current discomfort, dysphoria, whatever you want to call it, to help them understand and accept themselves, to help them cope better with reality too, has always been one of the aims of psychotherapy, to help people cope better with reality, not to help them escape into a fantasy dungeon of delusions. So it's about exploration. And that's true for medicine too. Medicine isn't supposed to be, you tell me what's wrong with you and I'll just send you off to the appropriate surgeon so you can have surgery. Medicine's always been about exploration too. And that's the scientific method that our society's based on. You explore all the possible options. You look for evidence. But in psychotherapy, you do that, but you do it with a lot of compassion and empathy. Of course, you don't tell people that they're being ridiculous if they say they're the opposite sex. You explore the whole thing in a supportive way to help them get a better understanding of what's really going on. Because most people don't really know what's wrong with them or what's happening with them, why it's happening. They don't understand all the factors. That's why they come to therapy, for help to understand themselves.
It's bringing them back, isn't it?
Oh, yes, you're right. Sorry?
It's bringing them back, isn't it?
bringing them back to reality and to being sort of grounded and living in the present and relating to the people around them, not disappearing into this terrible narcissistic sort of dark tunnel within themselves where they define what reality is. I mean, that is not psychological health, where you're the one defining reality all by yourself.
So the morals that I grew up with aren't the same morals that you grew up with, and morals come into this. Yep. And do they,
yes,
bringing them back to reality, do the morals start to kick in again? Do you start to have to retrain them, or how does that work?
You'd probably call it values, and you'd be looking at their values, looking at their deepest values, and most people, when you explore their values, it's kind of, it's close to morals, but it's not that sort of judgmental sense of what's best, but it's about, what actually matters to you. And we do this with anorexics too. We don't say, what do you want? You want to have no body fat whatsoever. You want to be a skeleton, and that's wonderful. That would be affirmation. We say, what do you actually want in life? And is this going to get you there?
So
you want to go to university and become a vet. Now, if you starve yourself, is that going to help you go in that direction? You want to have a family. You want connection. Is this helping you go there?
Some people are looking for a sexual side of this. They're addicted to porn. John and I have had many a conversation on this, and they're more addicted to the fantasy of the pornography side of things than they are about being engaged in real life. Do we see that in the trans movement a lot?
Definitely. Well, what we see in the trans movement is that most of the trans activists are autogynephiles, that is, men who are sexually aroused by the thought of themselves as a woman. And these men a lot of them are narcissistic, the trans activists, and a lot of them are psychopathic, the trans activists. Not all autogynephiles are narcissistic and psychopathic, but almost all trans activists who are autogynephiles are narcissistic and psychopathic. And they, strangely enough, they don't usually give up their genitals. They keep them because they believe that, most of them are heterosexual, they believe that they're going to need them when they find a lesbian who wants a woman with a penis. The fact that there aren't any lesbians who do want a so-called woman with a penis doesn't seem to bother them because they're determined to force themselves on lesbians. However, these same men are advocating for children to have their genitals cut off.
The whole porn industry has developed itself into that aspect. I've seen a transition of normal pornography into this deviant side of things, and as that's happened, we've seen a lot of individuals thinking that this is okay. And that's where I guess I was talking about the moral aspect of things, because the morals that, we're brought up with from just, having, parents who work and educate their kids and pay attention and, work as a family with a core family values. They're being dragged into this, sorry the pun, but they're being dragged into this in a sense that it's tough to get out of. And we've got to give them that information now, and that's exactly why we're here. And I think that, this information, both in this episode and even in the second half of this episode, are all worthy. Like, we're talking about so many things here that can help people. And whether you're a male or a female, whether you're trans or whether you're bisexual, there's all kinds of information within Unmasking the Trans Movement that's going to help you understand maybe what took you down this dark path, maybe what can get you back away from this dark path. We have lots of options here, and that's what we're about, is providing options and providing the resources that really can help elevate a person back to reality and bring them out of this zone that they've been stuck in for a period of time, and have really, you can't grab somebody and just pull them and tug them away from this movement. It's a cult, and they keep getting pulled back into it. So, we've got to somehow get them to bounce back into reality and question why they're even involved in this in the first place. And I've seen some kids that are 15 and 16 years old that have done that. All of a sudden they were in the group, and then they saw somebody sitting over there by themselves, and they've disassociated. I don't really think I'm that way anymore. I kind of feel like a girl again, or I feel like a boy again, right? So
they realized it wasn't real.
That's exactly it.
Usually takes 8 to 10 years for them to go, oh no, this actually isn't helping me. I'm still really distressed. And now I don't have genitals. I don't have functional genitals. My body has been ruined. I've got all these long-term chronic irreversible side effects. It's very hard for me to have a relationship because most people don't want to have a relationship with someone who has gone through this process and is someone who's turned themselves into a trans person. So, yeah, I would say that values encompasses morals. And we could talk more about that. But, yeah, I know exactly what you're saying. But I'd also say that sex has become the new opiate of the masses. It's like a religion. Sex, sexuality, gender identity, it's like our religion now in our society.
Sad place we're at. Sad place we're at.
It is. It's very empty, narcissistic, delusional place to go. And it isn't helpful for people's psychological or physical health or their spiritual health, if you want to look at it that way. I'm not religious myself, but I still think of the human spirit and the need to live in a way that isn't harmful to yourself or to others. Those values are really important. And when you're harming yourself, you can't possibly be happy or healthy. And you're also harming others because others are connected to you and they have to see you being mutilated and having your physiology deranged by harmful drugs. So you're harming everyone who loves you as well.
Jenny, and that's part of the danger. That's part of the concerns about the affirmation model. If you'd be willing, stay right there. We're going to pick it up in part 2 of this episode. And we will cover also, I would like you to speak to, and really the two of us together as therapists, we're going to cover some of the key red flag indicators of a young person who has had or is currently having their sexual boundaries crossed. So that if a therapist, if a teacher, if anybody who's a mandated reporter sees these signs, but especially medical personnel or a therapist, and if they turn a blind eye to blindly affirm, they may in fact be, and almost inevitably, they're going to be missing some serious red flag indicators that could really cause a child to stay in a very unhealthy, if not abusive situation. And that also then turns a blind eye to predators. So would you stay right there and we will pick this up on part 2.
Absolutely. Looking forward to it.
Brad?
Thank you very much, John and Jenny. We have got so much left to talk about. Episode 1 was fantastic, and episode 2 is going to be more compelling as well. This is Unmasking the Trans Movement with John Mueller. I'm your host, Brad Wilder. Until next time, remember, this isn't your kid's fight. This is our fight. We'll see you soon.